Hello, good morning, good afternoon, and good evening, everyone. Welcome to episode number 99, our 99th webinar for the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being a part of our credible online community, and to all those who have just discovered us for today, welcome po. Sana po masayahan po kayo sa ating topic for today on boosters. 3 weeks ago, ang ating pong Secretary of Health approved the recommendation of the Health Technology Assessment Council or ang ating HTAC na magbigay ng second booster or fourth dose po mula po sa hanay ng mga COVID-19 vaccines natin. Yun po yung mga AstraZeneca, Sinovac, Pfizer-BioNTech, Moderna, Sinopharm. Pero ibibigay lang po siya sa mga immunocompromised na mga tao na 18 years old po pataas. Ito, sino po ba yung mga ganon? Ito po yung mga nakakatanggap po ng gamot para sa cancer, mga gamot na immunosuppressants po ang tawag para po hindi po masyadong malakas ang panlaban po natin sa immunity. Doon po sa mga hindi pa po nagagamot sa HIV infection or meron na pong advanced HIV infection at marami pa pong iba. Meron naman po tayo naririnig na over the past few weeks din po ng mga requests from healthcare facilities, healthcare workers specifically, pati na rin po sa ibang cohorts natin including senior citizens at pati na rin po ang mga overseas foreign workers na nagre-request na pwede na po ba silang madagdagan o mabigyan ng second booster or ng fourth dose. However, medyo mahina pa rin po kasi ang uptake ng ating vaccination para po sa primary series at ganoon na rin po sa ating first booster for the primary series specifically po for our senior citizens. For today's webinar, tatalangin po natin ang katanungan, kailangan ba talaga natin ang second COVID-19 booster at makakatulong po ba ito sa ating katawan? I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date or our Fridates. Always looking forward also to Fridays with my partner po, co-host in this webinar for the past 99 webinars po, no? Our Adjunct Research Faculty at National Telehealth Center and the Special Envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. I know people are watching from all over the country. We're so happy to be with you on a Friday. Somebody said nga in the chat na parang hindi buong Friday pag wala yung webinar. Kami din ni Raymond, may withdrawal symptoms kami pag walang webinar. No? It's been a pleasure being with you, being able to help in whatever way we can. And we'd like to make special mention of all of those who are watching us from the PGH admitting section, OBAS. Palakpakan natin sila. Kanina ko pa nakita may mga taga-OBAS na nanonood.
You're on mute, Dr. Susie. Sorry.
Okay. So habang nag-aantay kayo ng mga anak diyan, a good time to just listen to some of the discussions, and certainly we have a lot of things to talk about, no? Itong booster nga, sabi ni Raymond, no? You'll notice that in the opening billboard, sabi natin, 2 years na nga, di ba? 99 na nga to. Do you guys know that Raymond and I have not seen each other in person for 2 years?
Or 2 years.
For 2 years na. So baka malapit na kaming magkita ng face to face. Pero anyway, so 2 years na, we said, okay, we have to continue to talk about COVID kasi marami pa ring mga issue, marami pa ring problema. Pero meron din mga ibang bagay. So we said, okay, let's not change the title. COVID would be current COVID-19 problems. O would be other outbreaks. V would stand for viruses, I for infections, and D for disasters. So these are things na hindi masyadong napag-uusapan ng malalim. So you get the news, but what we want to do is to give you an in-depth view of the latest information. And as always, we try to get the best speakers for you. So we have the best speakers today to talk about boosters. Ano ba yung boosters na yan? Kailangan ba yan? Ilang booster bang kailangan? habang buhay ba tayo magbabakuna laban sa COVID, no? So we will learn more about this, and yeah, we're really looking forward to a very interesting webinar today. So stay with us. Okay, so one of the things we added was news. So TVUP, take it away. Okay, according to the British Broadcasting Corporation, North Korea has confirmed its first death from COVID-19, with state media adding that tens of thousands more are experiencing fever symptoms. According to the report, 6 people died after suffering from a fever. 1 tested positive for Omicron COVID-19. And 187,000 people are being isolated and treated. And apparently, recently, 350,000 people had shown signs of fever without being able to be tested, no? And what we're also seeing, what we know about this, Raymond, let's talk about this nga, kasi ang alam ko, hindi nagpabakuna ang North Korea, right? They did not implement any vaccination program, but they closed their borders. Am I correct, Raymond?
Insofar as the news has given us po, we have limited coverage po kasi with regards to anything that's coming out from North Korea. So personally, I was surprised that they were able to share that they experienced their first death due to COVID-19 just very recently. We also are not sure if they produce their own vaccines or if they really shunned any procurement outside from the Western world in terms of any other vaccines po, no? But for the most part, I think it's a refreshing change of pace just to be able to hear from one of the more really talagang close off po ng mga countries po, to be able to share that piece of information.
Well, 25 million people, that's a lot also, no? So there are 25 million people, but I think to have 350,000 people with a fever and not having the benefit of vaccination or sufficient testing, I think this is a hot spot that the world has to watch also, right? Because
Right, sure.
I don't want to speculate, pero kung hindi natin alam kung, can you imagine 350,000 people with a fever? That's very difficult to imagine, right? I mean,
Right.
we have had surges of COVID, but people are not febrile. They just have, they have a cough, they have a cold. So we don't know which strain of Omicron this is, knowing that there are various variants of Omicron, and it's just very close to South Korea and to China. So let's keep an eye out for that one. Okay, let's go on with our webinar, Raymond, and let me see. Okay, Raymond, we're gonna cue our persons on the street.
Yeah. So, thank you, Dr. Susie, for our news item for the week. And as Dr. Susie mentioned, better to keep an eye out for all of these new pieces of information that's coming out. Lalo na po that we really are not yet out of the woods, so to speak, with regards to the pandemic. For those who are joining us for the very first time, we usually have this section in our webinar wherein we show the pulse of the nation po as we know it. We call it as person on the street interview videos po, just to set our discussions into context. And the question that we pose to the person on the street are as follows: nabigyan na ako ng 2 bakuna, kailangan pa ba ng booster shot? Mayroon akong naririnig na nagka-COVID pa rin kahit bakunado na. So, kailangan ko pa rin po ba magpa-booster? Hindi ba ako magkaka-side effect kung karami-rami ng mga bakuna na natatanggap ko? At hihina ba ang aking immune system dahil paulit-ulit ang mga tinutusok sa akin? TVUP, take it away.
Actually, nakapag-booster shot na rin ako. So, sa tingin ko, tama lang na magkaroon ng booster shot.
Para sa akin, parang ayoko na magpa-booster eh. Okay na sa akin kahit na yun na lang, second dose na lang.
Para sa akin lang po Para saan pa po ang booster kung meron naman na tayong 2 vaccine? So, ibig sabihin, kapag napabooster ka pa, di parang hindi ka pa sure dun sa 2 binaksin sa'yo.
Kung kailangan naman po magpa-booster shot dahil sinabi ng mga expert, possible naman po. Pero so far naman po, ever since na nagpabakuna ako, kahit nung wala pa akong bakuna, hanggang sa nagpabakuna ako, hindi naman po ako nagkaroon ng virus.
Tama lang na magkaroon ng o mag-booster shot kasi hindi pa rin natin alam kung sino ba tong virus na kinakalaban natin. So, mas maganda ng protektado kaysa hindi ka pa bakunado.
Ako kontento na ako sa ano. Pero yung iba gusto naman, pero para sa akin okay na eh. Okay na sa akin na kahit hindi ako magpa-booster. Wala namang ano sa katawan ko.
Kasi 'di ba meron pa rin yung mga sinasabi nila na dahil nagkaroon na ako ng COVID, hindi ko na kailangan magpa-booster, natural immune system na lang siya. Para sa akin, iba pa rin yung merong kang parang depensa.
Para sa iba, siguro baka depende rin sa immune system ng tao. Kasi kung mahina, di ba, yung naano nga yung vaccine, pag mahina yung katawan, di ba, yung iba namamatay. Yung iba naman nagkakasakit pero normal lang. So depende siguro sa katawan.
Magpa-check up na lang po muna sila. Tapos kung sabihin sa kanila ng doktor nila na kailangan nila ng extra shot, yun po.
Hindi na, wala namang side effect kasi dito sa amin, wala namang nagpa-booster na pero wala namang naging side effect. Para sa akin, normal na lang yan eh. Kasi parang pangkaraniwan na lang yung COVID eh, na pangkaraniwan lagnat na lang na hindi na mawawala.
Kahit anong bakuna, kahit anong mga gamot na dumating, kung hindi mo rin talaga aalagaan yung katawan mo, kahit simpleng ubot sipon, pwedeng lumala.
Okay, thank you very much. Thank you very much, TVUP. Always very interesting to hear what the person on the street is thinking. And I think some of the points that they have raised will be touched on by our speakers today about, whether it's really necessary, how important is it just more important to boost your own immunity in a natural way? What do we need to do? Okay, so we are going to hear from some experts. And before that, let me turn over to Raymond. Raymond, may announcements ka ata.
Thank you, Dr. Susie. We'll start off our announcements with the certificates. Again, napadala na po namin ang lahat po ng certificates for the 97 webinars. Meron pa rin po mailan-ilan na hindi pa po nakakatanggap for their webinar number 98 certificate. So that's something that will be trying to complete in the next few days. But just a reminder, certificates of attendance will be given to those who have watched at least 50% of the webinar duration. So yun po talaga ang makakatanggap lang po ng electronic certificate of attendance. For today's webinar, we will have, again, a standard panel discussion format. We have our presenters, and then we will move on to a Q&A session. There will be questions that we will be entertaining, not just from the Zoom, but for those who are watching us in the YouTube and Facebook live streaming links po ng ating TVUP, Stop COVID Deaths, and also the University of the Philippines. So we want to invite everyone, lalo na po our more than 1,100 registrants, kasi we are seeing, at least in the Zoom, that there are only less than 600 po attendees for our Zoom webinar. But our webinar po kasi can accommodate up to 3,000 participants. So please join us in Zoom so you can fully experience this interactive program. If you have any questions that you have prepared beforehand, you can put them in the Q&A box po dito po sa ating Zoom. And there are also comment sections din po. We will be scanning them, trying to identify which questions po are the most relevant for them to be posed to our panel of experts. We will move on to our fun quiz, but before that, there's our very, very cute and short introductory video.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Thank you so much,
Ako natatawa doon
TVUP.
Natatawa ako doon. Cute! O sige.
Very
Okay.
cute, very cute. May we have it on the screen po, especially our Slido for today. For those who are outside of the Zoom and would want to participate, especially sa YouTube and Facebook, just open your internet browser, type in dun po sa address bar, slido.com. And when you're prompted, input the code 549667. That's 549667 for you to be able to participate in our fun quiz. This will serve as parang pre-test po para po maalala nyo rin po ang mga salient points for our webinar. For the first question, it reads, ikaw ba ay magpapa-second booster kung ito ay in-offer sa'yo sa ngayon? The options are yes, no, and undecided. We just want to get a flavor po of those who are interested in getting that second booster, ang pangalawa pong booster, no? Especially if you are joining us from the Central Luzon Occupational Safety and Health Network, City of San Fernando, Pampanga, the Senate of the Philippines in Pasay City, the Provincial Planning and Development Office in Mamburo, Occidental Mindoro, the Department of Education in Gasan, Marinduque, Zamboanga City Medical Center in Zamboanga del Sur. And for our second question, ang COVID-19 booster ay nakakapagpaigi ng immune system. I think ang ibig pong sabihin nito, COVID-19 boosters enhance your immune system. So is it true or is it false? Medyo madali lang po ang ating mga katanungan for today. We would also like to greet those who are joining us from the Ministry of Health in Bandar Seri Bigawan in Brunei, from the Chonin Hospital in Taipei, Taiwan, ngayon tayo Hoc Polyclinics in Vietnam, the University of Hail, Prince Sultan Military College of Health Sciences, and Qasim University, all from Saudi Arabia, Lulichi Al University of Blida 2, and Stockton, California attendees, Philippine Nurses Association from Edmonton, Alberta, Canada, and finally from the St. Eustatius, Netherlands in Antilles po. So, we will not be closing po just for now ang ating fun quiz. We all know that you are very, very eager to join in. We are seeing na a little over half pa lang po ang nakapag-input ng kanilang mga kasagutan. So, please feel free to join us in this fun mini quiz. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. Ako, I always appreciate and enjoy the fun quiz kasi ito fun talaga kasi opinion di ba?
Yes,
Yung
yes.
opinion. Oo, sige, okay. So let's go to the main part. I think you are all very excited to hear our main speaker, and as we have said, we only bring you the best speakers that we can find, and we're just so grateful that when we ask itong mga specialista natin, talagang umuoo sila, tsaka talagang kinakarir nila yung mga presentation nila, no? So I spent a lot of time watching the replay kasi there's really a lot to learn from our very, very competent, excellent doctors in the Philippines. No? Magagaling talaga tayo. Okay, so let's go. We have today a familiar face. We've had her with you on the webinar. Previously, she's the immediate past president of the Philippine Society of Allergy, Asthma and Immunology, and professor with the Division of Allergy and Immunology of the Department of Pediatrics, UP PGH. Let's welcome Dr. MARYSIA RECTO. Hi, MARYSIA, how are you?
Good afternoon, Dr.
Good afternoon po.
and Dr. Raymond. Thank you very much again for inviting me. Hopefully we can answer some questions this afternoon.
Oo, and thank you for joining us. We know you're always very busy, pero mabuti na paunlakan mo ang ating audience. Thanks.
Oh, anything for you, P.
Sige, go ahead. MARYSIA, go ahead.
Okay, so I think I will start my lecture. We'll share the slides.
Daming hearts, gusto nila si MARYSIA.
Correct.
hearts, nakakatawa. Oh, ayan pala ang dumami. Okay, let's go.
Okay, so I was asked to speak about this topic. Just to remind everyone, last year I was also invited to speak on the vaccine, no, efficacy and safety. So now, 1 year later, the topic has evolved already to involve the boosters. And the controversy of the moment is, are they really needed, okay, by most of the population? So let's take into context the state of vaccinations that we have around the world. So as of May 7, 2022, a total of around 11 billion vaccine doses have been given already. And in the Philippines, on the latest statistics, we have seen 150 million total doses given. Many patients have already received the completed dose and their first doses, and there are some that have already received the first booster or the third dose. So, vaccinations are still the mainstay in trying to prevent many infectious diseases. And for the COVID vaccine, Gregory Zuckerman has coined the COVID vaccine a shot to save the world. Now, we know, based on the DOH or the WHO rather recommendations, that vaccines are still one of the most important tools for preventing outbreaks and keeping the world safe. But we have to realize that there's still a lot of vaccine inequity, either due to hesitancy or due to lack of availability. And that's why there's still a lot to discuss, a lot to learn about this COVID-19 vaccine, because it is not seen around the world that we have the same opportunities. So COVID-19 is a virus. There is no cure to it. The most we can do is immunize. And there's several forms of immunization. We have the active immunization. This is the vaccines, wherein you have little particles of the vaccine or a whole-killed vaccine that will incite an immune response in a person naturally because of the vaccination. Then there's also convalescent plasma therapy. This is the antibodies that were taken from previously infected individuals and given passively to the person mainly for controlling disease or lessening severity. And now we have designer antibodies. These are engineered antibodies, which can be monoclonal or combination antibodies that have been found to block the infection or prevent infection or lessen disease because of blocking the effects of the COVID virus on the immune system. But what we will be focusing now on are the vaccines. So as a pediatrician, I really know vaccines are very important to control many diseases. And we've been having vaccinations for decades, no? And we also know that the conventional pathway for vaccine development takes years to establish efficacy, safety, and immunogenicity. But the COVID-19 vaccines are actually unprecedented. This is because of the need of the times that we have to control a disease that is really potentially deadly, not really deadly. So the vaccine development of the COVID vaccine was really fast-tracked, mainly based on knowledge that has been done through years of technology that is now being applied. However, the rollouts are already going on, even if we do not yet have the full clinical picture of this. And that's what I'm trying to say right now is everything is in a flux. Everything is being developed. Everything is still being recognized because up to now, we are still observing the effects of this COVID vaccination that started last year. So last year, the issue was about efficacy. And I think Dr. Jen Agustin will talk about the safety issues. But efficacy then was a concern. And if you look at the overall efficacy rates on the right side, you could see that there were certain vaccines that really stood out. These were the mRNA vaccines that seemed to be more efficacious compared to the whole virus vaccines, no? But what is common among them and what we have seen, and it is we are reaping now after doing the primary series of 2 vaccinations, is that there is almost 100% effectiveness against severe disease. Okay. Now, I'm talking about efficacy. Effectiveness means in the real world setting, we have really seen that there is a significant drop in severe disease nowadays, despite the number of the world is starting to open up already. We're having all these get-togethers that can potentially lead to severe disease. But now the concern is about a waning immunity. Now, most of the time, the gauge of assessing whether a vaccine is immunogenic or not is through the levels of neutralizing antibodies. So this particular study was done in Israel. Israel was one of the first countries, or if not the first country, to really have a almost full vaccination of their population, including boosters. And they were the ones who are now giving us the data about this waning immunity concern. So if you look at this slide, wait, let me get my pointer. So you would see here that after the second shot in Israel, they noted starting Asthma around 10 weeks after the second shot, there was really a waning immunity. Now, what level of antibody level would say that there is no protection? This is what we call the correlate of protection. This still has not yet been pegged by experts, but they just saw that there is a waning immunity. However, the Delta surge came, and this was around the time that the second shots were already were finished. So they had to, and they had the ability to have their third shot. We call that the first booster. And they found that indeed the antibody levels started to rise again. However, it did not go as high as the second shot, but then it started going down again. And they were faced now with the Omicron surge. So because of their ability to have more vaccinations, then they embarked on a fourth booster. And based on the experience of Israel, a lot of countries are looking at this, and even the Philippine DOH is giving the recommendations based on the Israeli studies. Now, the question is it applicable in our setting? So we have to find that out. But before we go on, let us discuss a bit about vaccinology. What are these boosters? What do we call the primary series? So when we have an injection or a vaccination, that is the first shot. And of course, later on we'll discuss the immune responses, but you would have a boost or maybe an increase in the antibody levels in the blood. And this is what we call the primary response. Now, this primary response will generate a certain level of antibodies. Now, this primary series or prime regimen can be 1 shot, 2 shots, 3 shots, depending upon the kind of vaccine or organism you're trying to control. But these antibody levels are known to wane because antibodies are degraded by our system. So that means that sometimes there may be a need to really have a booster in order to provide a heightened and more sustained immune response. The antibody response can hopefully stay. As you notice, there are some vaccines that you only need it in childhood because the effect lasts for your lifetime. But there are some, like the flu vaccine, that you see that the booster response can also go down eventually, and you need periodic boosters. So these are things that only will be noted with time. So again, this slide may seem to be intimidating, but it is also important for us to understand how vaccine immunity is generated, for us to understand the need for the boosters. Okay, so you see here that the vaccine contains an antigen from the virus that is coupled with an adjuvant. And this adjuvant will increase the signaling to the immune system to produce a more heightened immune response. So the first cell that gets exposed to the antigen is called an antigen-presenting cell. This cell will now be able to present that antigen to the immune cells in a modified manner. And this immune cell that are very important for the generation of primary immunity are the T cells. So we have 2 kinds. We have the CD4 cell that is important in signaling the B cell. The B cells are the factories of the antibodies. And so when the B cells get activated, they will become rather plasma cells, and they would produce the antibodies that will hopefully kill that infection. These B cells are in the bone marrow, okay? And they are there because they will be generating the antibodies for a while. But eventually they will calm down. And so the B cells also have a set called the memory B cells that once exposed again to the antigen, to the infection per se, then this will become plasma cells again and produce antibodies. Now there's another group of T cells that also get activated. These T cells are called your CD8 cells that are important in fighting the disease, in killing the viruses. That's why when you give it and you have the T cells or the CD8 cells active, you can kill the virus, but they also have memory counterparts that are important in future infections. So you see that it is a synergistic effect or the perfect team of having antibody and T and B cell responses to generate vaccine immunity. And this was actually seen based on infection. So the natural course of an infection is after the infection, your body or your immune system will produce your antibodies that will combat the symptomatic infection at that time. But this wane, but they do not really go away because there is memory from your T cells and your B cells that will again allow for more antibody production. Now, what is also very interesting is it has been found that the T cell immunity has been correlated with lesser severe disease. So if you have a very good T cell response, these are the patients who will not get severe disease and may possibly have long-term protection. So many questions occur about whether a natural immunity with a COVID-19 infection is the same as having a vaccination. In fact, these are some of the theories that our anti-vax people are proposing, but it is not the same. If you look at this slide, you see that the CD4 responses, of course, get heightened in both vaccinated individuals and also with infected individuals. However, the CD8 cells, which are important for killing the virus, are more stimulated with your COVID-19 vaccine compared to those that are just infected. So it just says that it seems, based on this particular study, which was done in 2021, that vaccine-generated immunity may be better than natural infection. And in fact, now studies are being done to see whether hybrid immunity, this is vaccinated and infected individuals, will have better immunity compared to just either vaccination or infection alone. So we abangan pa yan. So going back to the principle of vaccine boosters, after the first vaccination, you have your primary response, which can wane with time. The second vaccination will induce a second larger and stronger immune reaction. That's why we call this the primary series. Now, this was what was done in the clinical trials. But they have found eventually that this second vaccination had waning antibody levels. And so the question was, is this a third vaccination or a booster that is needed? Okay, so they have found that with the third vaccination or the third shot, there is an increase again in the antibody concentration. So the question is the third shot really a booster, or is it really part of the first two shots as a third shot to become a primary series? So yan, hindi pa yan nare-resolve. But what has been found that indeed there is a dip again in the antibody levels after the third shot. And this brings the concern about the fourth shot. And so our DOH looked also into the studies done in Israel. So let us also take a look at the studies of Israel most of the population, and some of these studies that have been published on the 4th dose of mRNA vaccine. So Israel has been using mostly or all mRNA vaccination, and they did this in response to Omicron. So in this study of almost 1,000 healthcare workers 18 years old and above, they received 3 doses of the Pfizer vaccine. These patients had no history of COVID-19 infection in the past, and they included people whose vaccine titers were less than 700 BAU. So this was their PEG correlate of protection, meaning for these investigators, a level of 700 BAU and below was indicative of the need to be vaccinated again. But again, this level is not universally determined yet. So that intervention, they gave either a 4th dose of Pfizer or a 4th dose of the mRNA booster, which we know is usually half the dose, no? And this was administered 4 months after the 3rd dose in a series of 3 doses. So why 4 months? It's because some preliminary studies done in the UK showed that around 10 weeks, you would already have waning of immunity. So the comparator was an age-matched control without the 4th dose. These are also healthcare workers. And they looked at the immunogenicity and safety of the 4th dose of the mRNA vaccine. Okay? And what did they find? That the recipients of both vaccine types had a 9 to 10-fold increase in their serum antibody levels against COVID-19 and neutralizing antibody titers within 2 weeks of vaccination. So when we dissect it, you look at this. After the 2nd dose, there was indeed a dip in the antibody levels. And you see here the PEG of the correlate of protection, that this is their level where it was dangerous. But when they gave the 3rd dose, that was the 3rd boost or the 1st booster, if we call it that way, then it went up, it went higher a bit. Compared the antibody levels compared to the 2nd dose. But this again waned. Now, on the 4th shot, they found out that the levels were put back to the 3rd dose level. Now, what happens next? We still don't know. Will this 4th dose start waning? And this was also seen with the neutralizing capacity to Omicron. They found an 8-fold increase in the live Omicron neutralization, restoring titers to those measured after the 3rd dose. So this study noted that breakthrough infections were common among the vaccinated, although most were very mild. However, they had high viral load. So this 4th shot did not really prevent against transmission because the people still were able to have high viral loads. But they found vaccine efficacy against infection was 30% with the Pfizer and 11% for the Moderna vaccines respectively. There were more adverse reactions noted in the Pfizer because it was more reactogenic, especially in the younger population. So the authors actually said that the 4th dose may not really boost immunity, but will simply restore it to peak levels. And marginal benefits are only seen in the younger population. So for me, personally, you have to think, is the 4th dose the booster and the 3rd dose primary series? And that you just really have to give a 4th shot intermittently? We still have to find out. And about the need to give it in the younger population, is it really needed? Will the risks, will the benefits rather overcome the risks? So it is yet to be observed whether the waning of this 4th dose will be at a similar rate as that observed with the 3rd dose. Because in the elderly, they really found it waning. So I'm presenting this to you for you to also make your decisions. Now, there's another study also done in Israel on the 4th dose of mRNA vaccine, Pfizer vaccine, this time in real-world setting. And so they looked at vaccine effectiveness, not efficacy. So this particular study was done in patients 60 years old and above, so the elderly with no known SARS-CoV-2 infections. And they were given a 4th dose of the Pfizer administered 4 months after the third dose. They looked at the vaccine effectiveness in several populations. In those who had asymptomatic infections as determined by PCR, those who had symptomatic COVID-19, mild symptomatic, those that had severe disease, and on 2 time frames, 7 to 30 and day 14 to 30 days after the 4th dose. And what was seen in the different populations, no, you would see here that the vaccine effectiveness was actually higher for severe and basically the critical COVID, which is what we've seen with the initial studies done about vaccine effectiveness. But you see the risk difference is significant with those that had the milder types of infections. And this was actually seen also in the day 14 to 30 group. So they found actually that the daily vaccine effectiveness of the 4th dose of mRNA vaccine, and this was a Pfizer vaccine, that it's continued to increase with time. And basically saying that the 4th dose of the Pfizer vaccine increased protection against the different populations as compared to only a 3rd dose given at 4 months. But this is in persons 60 years old of age and earlier. So we do not have this data really for the younger crowd, nor do we have this data for the other types of vaccinations. So further studies will also be needed to determine whether you need to vaccinate less frequently or you have to offer a combination of different COVID-19 vaccines like heterologous injections for a superior long-term strategy. So I will be showing to you a few preprints. Now we know that when we talk about preprints, these are not yet peer-reviewed and they have to be taken with a grain of salt. So these were also done in Israel. So here in this group of patients, again, 60 years old and above, some of them received the 4th dose, while some received 3 doses. So more received the 3 doses only. And they wanted to look at breakthrough infections, basically positive SARS-CoV-2 PCR on day 7 post-vaccination, and breakthrough severe disease within a 10-week follow-up period. And the results of the 4th dose versus the 3rd dose in the elderly population was that the 4th dose provided additional protection against SARS-CoV-2 infection and severe disease. They found that vaccine effectiveness against infection of the 4th dose varied over the time and declined by the 10th week follow-up period and waned sooner than the 3rd dose. So what's that telling us? No? That it is just going to wane as well. Vaccine effectiveness of the 4th dose against severe COVID-19, though, was maintained at a high level throughout the 9-week period. So remember what I said about antibody responses and T-cell responses, that the T-cell responses are the ones that are into play in trying to control or prevent against severe COVID. So severe disease was a relatively rare event in those given 3 or 4 doses. So that makes us think, is antibody immunity the only way by which we can gauge effectiveness of a vaccine, or is it the T-cell responses? That's up to us. So in this other study, which is also a preprint, looking at the protection of the 4th dose of the Pfizer vaccine, again, this is in the elderly. So there were really a lot of studies done in the elderly, not in the younger population. You could see here that after the 3rd dose, there was really more infections compared to those that were given the 4th dose. And as they get, as time goes by, you could see that the risks are less, especially for the severe illness. So look at this, all this data and try to process it. I cannot really tell you which is the best. Should we receive 3, 4, 5, 6 boosters? At this point, we don't really know. But we have to think of the advantages of boostering, that we have seen that based on previous vaccinations, there is really an immunity boost capacity, especially in those who have weaker immune systems like cancer, on immunosuppression, and the elderly. And also infection reduction has been seen, especially again for severe disease. But the gray areas are there. How long do we really give it? How often? Who are the real targets? Should healthcare professionals be included? And are we going to consider that 3% of Africa, let's say, or even in the Philippines, is not fully vaccinated? There is no global control of the pandemic without equity in the supply of vaccination. So even if we take 10 vaccines and our colleagues in Africa are not having enough vaccination, then there is really going to be no effective vaccination that we see for COVID-19. So here are other issues. What is that threshold of protection? What is that level of antibody levels that will say that it is really protective? We still do not have that. And then we want to see which groups, again, I've mentioned this, what is the optimal timing for the third dose? And will the booster protection be sustained or transient? Some studies have shown that this does not really happen. How often should we boost? We don't really know. So here are some considerations and issues in giving COVID-19 vaccine boosters. First of all, when we make our recommendations, we should make sure the evidence is strong enough. So far, we've only had the studies of Israel. Next is, what do we really want to achieve with the vaccination? Do we want disease prevention or efficacy against severe disease and mortality? So far what we have seen is that severe disease can be controlled, but infection cannot yet be controlled with our booster. So we have to find out, should we make more or different types of vaccinations that will address our need to prevent infection? Now, the question about the primary series, is the third shot a booster or is it a part of the primary series? So far, we have seen that it can further boost immune reactions and that the fourth shot will just retain it to the third level or to the third dose level. Now, we are all aware about heterologous and homologous boosters available in our country. And if you notice, we have not really had yet our data on the mix and match studies, but looking at our effectiveness and maybe also our degree of ability to avoid wearing our mask and trying to distance ourselves as much as possible compared to other countries, we seem that there seems to be something good about these different types of vaccines given. We still have to address that. Now, what about the new variants? Will these boosters really prevent the emergence of variants? In fact, studies have shown that the booster regimens can actually widen the repertoire of antibodies generated by the vaccines, and that will cover even the variants. So boostering in this issue is actually very effective. We still do not know the proper dosing and timing because we still need time to determine this. Now, the question about natural versus vaccine boosting, is it good to have both infections or just to just take the vaccine or get a hybrid immunity? That again has to be proven. Also, long-term adverse effects and the concern of autoimmunity, which will be discussed later. Now, there's also conflicting data for those who have autoimmune disease and on immunosuppression. So our DOH has actually allowed it for immunocompromised or those on immunosuppressants. But so far the data is just indicating a benefit, but this has not been explored in big trials. And the last two important topics, we have to go over politics. We have to look at science over politics, maybe some agenda pushing vaccinations that are not really necessary. We have to think about that. And finally, the most important, we cannot achieve our herd immunity if we do not have vaccine equity. So in summary, the decrease in vaccine protection over time appears to be real for all forms of infection, starting from the 6th month after the second injection, but does not appear to have a real impact on the risk of COVID-19 related hospitalization and death. So I have to say that my summary statements are taken from Lubet. I got this because I feel that this is the summary of my talk. The decrease in protection is more pronounced in people older than 65 years and in those at higher risk of severe COVID-19. The usefulness of a booster dose is still debated, but is recommended in a growing number of countries for the elderly and in those at higher risk of contracting severe disease. Upcoming data on vaccine duration of protection and real-life efficacy and safety of booster doses will add evidence on its hypothetical interest in the general population. And finally, the priority should remain to vaccinate all eligible individuals not yet vaccinated with the recommended dose regimen so that we can go for herd immunity. So thank you very much for your kind attention.
Wow, thank you very much. That's Dr. MARYSIA Recto. Ang husay talaga ng presentation niya, no? I mean, when you look at all of the data that she's reviewed and she's given you the latest, hindi pa published yung mga journals, nandyan na, no? Naririnig nyo na. And really, there is a lot of studying that needs to be done. So many different considerations, no? And I think, parang, for me, it's like the decision on whether to boost, right, also depends on I think your main message was depends on our ability to also have everyone have the basic vaccination also, no? So that's really a very public health perspective. Thank you so much, MARYSIA. Tinan mo, puro heart. Puro
Thank
clap.
you, Dr. Recto. Thank
Oh,
you.
di ba? Tuntua sila. Oh, natutuwa rin kami. I will watch it again later. Gusto ko lalo yung T-cell explanation. No? Really a lot. Really so much that we can continue to learn. We're all what should I say, humbled by this pandemic. We really have to learn and study a lot more. Thank you so much, MARYSIA. Natutuwa rin ako. Sige, Raymond, our next speaker, napakahusay din. Go ahead.
Yes. Thank you, Dr. Recto. We'll see you in the Q&A po. For our next speaker, she is, fairly new to the webinar, and we hope you'll give her a very warm welcome. She's the Division Chief of the Division of Allergy and Immunology at the Department of Medicine at the Philippine General Hospital. Please welcome Dr. JENIFER OTADOY-AGUSTIN. Dr. Jen.
Hello, good afternoon. Thank you for having me today. So I'll start my lecture.
Please go ahead po.
Yes. So in the next few minutes, I will present a summary of all received suspected adverse reaction reports following COVID-19 vaccination in the Philippines from March 2021 to May 2022. So at present, the FDA granted 9 COVID-19 vaccines with emergency use authorization, and 7 are currently being used in the National Vaccination Program. As of May 2022, almost 146.8 million doses of the COVID-19 vaccines have been administered. Over 67.9 million individuals are now fully vaccinated, either given as a single dose or a 2-dose vaccine course, and 13.2 million have booster shots. So data shown are the cumulative reports from the start of the vaccination program in March up to May 2022. So an adverse event following immunization may be any unintended sign, abnormal laboratory finding, symptom, or disease. And the presence of an adverse event does not necessarily mean the vaccine has caused the reported adverse event. And the assessment of adverse event establishes whether or not there is a causal relationship between the vaccine and the reported AE. So the data are based on reports submitted by the vaccinees to the immunization site where the individual is vaccinated, to the vaccine manufacturer, or through the FDA online reporting system. So a total of 99,246 suspected adverse reaction reports were received, evaluated, and analyzed. And these reports comprise 0.07% of the total doses administered. Of these, 7,686 are labeled as serious AEs, or 0.005% of the total doses administered. And this report contains all the suspected adverse reactions regardless of causality. So to disaggregate, 34,853 have been reported for CoronaVac, 36,119 for the AstraZeneca vaccine, and another 16,633 for the Comirnaty or the Pfizer vaccine. So the early phase of the vaccination program is intended for the frontline health workers. Thus, the high number in the females and the younger population might be associated with the data that our health system is dominated primarily by females and young adults under the age of 40. So an adverse event experienced after vaccination is considered serious when it resulted to any of the following. So inpatient hospitalization, significant disability or incapacity, life-threatening condition or death, birth defect or congenital malformations, and any considered to be medically important. So pregnant women are included in the A3 priority group for COVID-19 vaccination. So as we know, pregnancy is not a contraindication to getting the COVID-19 vaccine. And the most commonly reported adverse reactions include the labor pain, vaccination site pain, back pain, and myalgia. As of May 2022, 181 reports were received from the group of lactating mothers, and only 11 reports were tagged as serious. So overall, the data suggests that the benefits of receiving the COVID-19 vaccine outweigh any known or potential risks of vaccination during pregnancy and lactation. So the rollout for vaccinating the adolescent population started last October 2020, initially for those who had comorbid conditions, and later on expanded to include all the adolescents. And Comirnaty and Spikevax are the only vaccines with emergency use authorization for the adolescent population. And as of May, 3,600 reports were received and only 285 were tagged as serious. So vaccination in children 5 to 11 years old started last February 2022, and initially Comirnaty is the only vaccine used in this age group. And recently, corona vaccine has also been authorized by the FDA to be used in individuals 6 years old and above. So of the total serious cases in age groups 5 to 17 years old, so 7 cases were judged to have a causal association, and 2 were cases of anaphylaxis, 1 case of Guillain-Barré syndrome, and 4 immunization anxiety-related reactions such as hyperventilation and syncope. So the current reporting rate for anaphylaxis is 2.14 per million doses administered. And this is lower than the 11.1 cases per million doses of the Pfizer vaccine and the 10 in 1 million reported in Australia. And severe allergic reactions have been reported for all the different types of vaccines. So there were 4,400 confirmed reports of COVID-19 infections, and most of the reported infections were asymptomatic. 236 severe cases had resulted to a fatal outcome, and most of the fatal reports have not completed their vaccination. And upon assessment, these cases were not related to the use of the vaccine, but these were actual COVID-19 natural infections. Blood pressure increase has also been continuously reported as one of the top adverse reactions to all the vaccine platforms. So Pression, the prevalence of hypertension in the Philippines, alarmingly increased from 28% in 2013 to 37% in 2021 among adults 18 years old and above. And out of this, 37%, 19% are aware of having their hypertension, while 18% are unaware. The BP control rate is also low at around with or without medications, the BP control rate is only at 36%. So this can also explain the increased blood pressure increased in most vaccinated individuals. So blood clotting events associated with low platelet counts have been reported after COVID-19 vaccination. And a very rare new type of adverse event called thrombosis with thrombocytopenia syndrome involves the unusual blood clotting events associated with low platelet counts has been reported. And the thrombosis in specific sites such as the brain and abdomen appears to be a key feature of TTS. So what happens? So the heparin molecules are highly negatively charged throughout the molecule, and platelet factor 4 is positively charged. So when PF4 binds to heparin, it changes the conformation of the platelet factor, exposing a new antigen. And in some patients, this new antigen results in the development of IgG antibodies. So the immunoglobulin G forms immune complexes with heparin and platelet factor 4, and the immune complex binds to the platelet FC receptor, resulting to a strong platelet activation and release of more PF4. So additional immune complexes are formed, leading to a vicious cycle of platelet activation. And the immune complexes also bind to the vascular endothelium, creating a cascade of events that accelerate platelet aggregation and thrombus formation. So Guillain-Barré syndrome is thought to result from an immune response to a preceding infection or vaccination that cross-reacts with the peripheral nerve components because of molecular mimicry. So the immune response can be directed towards the myelin or the axon of the peripheral nerve. While Bell's palsy is a form of temporary facial paralysis, which results from the dysfunction of the facial nerve. So 13 cases of myocarditis and 2 cases of pericarditis have been reported. 3 cases of myocarditis have been assessed as product-related reactions, and the 10 cases, including the 2 cases of pericarditis, are still currently being reviewed. So although the development of myocarditis is not clear, molecular mimicry between the spike protein of the SARS-CoV-2 and the self-antigens trigger pre-existing dysregulated immune pathways, immune response to the mRNA, activation of immunologic pathways, and the dysregulated cytokine expression. And the reasons for the male predominance in myocarditis presently is unknown, but possible explanations are related to the sex hormone differences in immune response and also the underdiagnosis of cardiac diseases among women. So the optimal response to a virus requires that neither the pathogen nor the antiviral immune response results in the clinical disease. And an excessively robust antiviral response may lead to early immunopathology and disease. And CD8 T-cell exhaustion limits both the antiviral response and consequently immunopathology, tolerating the virus at the expense of the infection. Okay, so on the other hand, seeing antigens like those provided by the vaccines over and over again can lead to T-cell allergy or exhaustion. So T-cells become dysfunctional when they repeatedly see the antigen. So while T-cell exhaustion can be observed in cancer and in HIV patients in response to some immune-based treatments, it's never been observed in humans in response to frequent COVID-19 vaccinations. So right now, there is no science to back up the idea that the frequent boosters can cause fatigue in the population, and it is still an area for research. So we now proceed to the non-serious AEs. So the increase in blood pressure, cough, fever, headache, and dizziness were commonly reported AEs to the inactivated vaccines. So increase in blood pressure, fever, headache, and injection site pain were reported after receiving the viral vector vaccines. And the same, most commonly reported AEs were seen in the mRNA vaccines. So overall, most of the reported cases have recovered or resolved, although there are a few cases who have recovered but with sequelae. And over 14% of the cases are recovering, while more than 1% have not resolved at the time of reporting. Okay, so there are some limitations. So first, these AEs were gathered through passive surveillance based on spontaneous reports. And spontaneous report is subject to reporting biases, including underreporting, which may be in the case of the FDA report, or a second potential source of bias arises from stimulated reporting related to increased public awareness of a potential safety concern. So if you look at this, a lot of the reports were on the CoronaVac and the AstraZeneca vaccine because these were the vaccines that were administered at the start of the vaccination program. So it is possible that intense media attention during the beginning of the national COVID-19 vaccination program and heightened awareness of reports of adverse events have affected vaccine recipient and healthcare provider behavior and practices, including the elevated concern and anxiety and higher index of suspicion of the events. Okay, so what have we covered? No? So the COVID-19 vaccine far outweigh the known and potential risks of the vaccines. Most AEs are reactogenic and they resolve quickly. And the AEFI reports are important in monitoring the safety of the COVID vaccines. And finally, we use this data to address vaccine hesitancy. No? So the World Health Organization defines vaccine hesitancy as a delay in the acceptance or refusal of vaccines despite availability of vaccination services. No? And most patients, this study was done in North America, and they said that most patients would be vaccine hesitant. So as physicians or as healthcare workers, we should promote confidence in vaccination, especially among healthcare workers, and to our patients. We should take the time to fully explain the effectivity or efficacy of the vaccine and encourage the patients to receive the vaccine, especially the primary series and the first booster dose. So thank you for your attention.
Wow, thank you very much. Another excellent presentation from Dr. Jen Agustin. Naku, I'm sure you all learned a lot also from her presentation. I think many of the questions around, can you get, ano yan? Vaccine fatigue ba? What did you call it? Vaccine fatigue. No, so I think we're going to have a very interesting discussion. So we're going to now have our panel, and I'm turning over to Raymond, but I'm going to ask both MARYSIA and Jen to open their cameras. Go ahead, Raymond. Raymond, nandiyan ka ba? Okay, let me cue our public service announcement, which is part of our outputs at Stop COVID Deaths. Go ahead, TVUP.
O sige na, anak. Parang kagat lang ng langgam. Hantik o yung kumikiliti lang. Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ko rin po ang color nito. Pero ayaw ko po ng red hantik. Masakit kumagat at takot rin po ako sa blood. Magtudugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Color rin yan for love. Thank you, Doc. Thank you, Nay. Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths webinar team to push for pediatric vaccination for children aged 5 to 18 years old. Dr. Susie?
Raymond, may nagsuggest sa akin, dapat ilagay daw natin sa TikTok yun.
TikTok?
Ay, di ba? Pwede yata. Pwede yata ilagay sa TikTok yun O sige, meron ka pang announcement, Raymond, tungkol sa shorts?
Oh, yes. We understand po that everybody is very busy. So we have selected and we continue to create this very, very short, very consumable po ng mga videos. Just trying to distill po the salient points dun po sa ating mga webinars. We fondly call them SCD Shorts, and you will be able to find them if you go to www.youtube.com/TVUPPH, along with all of our 98 webinars to date. So, sana po makita nyo po siya at kung, let's say, papatulog or kung ano man po, that's something that will be helpful in your learnings as well. Dr. Susie?
Okay, thank you very much. Okay, so we've got our panel. We have MARYSIA and we have Jen with us. And we've got some interesting questions in the Q&A and I think in the chat. But let me start our discussion by asking both MARYSIA and Jen. It looks like, and I could be wrong, right? It looks like people are feeling a bit confident na parang tapos na yung pandemya, parang ganon. Kaya meron ngang hindi nagbo-booster, at saka marami pang hindi nabakunahan. So what do you think are the reasons behind that? And our audience are mainly frontliners, no? So what should we be doing? MARYSIA, you muna.
Okay. we have to realize that the COVID is here to stay. It does not go away. It is already beginning to be endemic, and there are still risks of severe disease in a certain group of population. No? These are the elderly, immunocompromised patients. So we should not let go. No? We should not think that it's over. It seems to have be controlled because we know a little bit more about the infection. We also have been good with our vaccines most of the time, no? Kasi hindi lahat nabavaccinate. But this lull actually proves that vaccines do work.
Yeah.
That we have to still continue vaccinating. So, tayo dapat maging kampante. Kasi nakakarally na tayo, wala naman nagkakasakit, but meron. I don't know about Jen, but I have consultations already of COVID. But they mostly are mild. So it's still there. You just have to be still careful.
Yeah, I think post-election, no? I think this week, next week, we might see, you're already seeing cases, we might see some more cases. And so then it becomes really very important to talk about this now. What's the level of protection, especially for the seniors? I'm glad you pointed that out, no, na for our seniors, dapat kung ano yung pwede natin ibigay na protection, bigay natin, di ba? Kasi alam natin very vulnerable sila to severe disease or to hospitalization. Jen, what are your thoughts on this?
It's a global pandemic. So some people, they look at the behavior also of the other countries, and they see that in the other countries, they are getting more comfortable having COVID, no? So their lives are slowly getting back to normal. And that's actually the point also of getting the vaccines, no? We want to get to a point that we're all protected enough so that even if we get the COVID infection, it comes off as a mild cough or a mild cold, so that we don't really need to be hospitalized and the risk of death is also low. But as Dr. Recto said, we should still emphasize the need to protect ourselves, no? So the vaccines work, physical distancing works, hand washing works also. So all these things put together should help us really eliminate this, or if not eliminate, then live with it and still proceed with our lives already.
Yeah, and I think the whole point of your presentation is that, even if there are some adverse events, they're not really that serious, no? Kasi yung pa rin ang nagiging argument na parang okay na baka magka-side effect pa ako pag umulit. No, I don't know where that idea comes from. It's probably just intuitive na, as much as possible, we don't like to get vaccinated or we don't like to drink medicine. But, you're right, in a pandemic, we have to use all the tools that we have, particularly to protect the most vulnerable. So, okay, so Raymond, let's go to you. I've seen some questions here in the Q&A. So Raymond, ikaw muna.
As always, we'll choose the most upvoted ones, and this one comes from Christy Andaya. Her question is there an added benefit to having a different vaccine, heteroseries, for the second booster? I think she's referring to if you've been having, let's say, the same vaccine for your primary and then a same or different one for your first booster. Should it also be different po ba for your fourth dose or second booster, Dr. Recto?
That's the million-dollar question. We still do not have the answer, but even for the third shot, no, I don't want to call it booster, whatever, because we don't know. But for the third shot, there's still some studies going on, no, about mix and matching. In fact, in our society, the Philippine Society of Allergy, Asthma, and Immunology, with DOH, we have a study on this, and the results are not yet out, no? Now, with the 3 shots, maganda ba yung dalawa na same series, and then we have a third shot with another? We don't know, but that is what has been happening. This is the real world scenario here in the Philippines, that because we do not have enough of one kind of vaccine, naghahalo-halo na talaga. And is this beneficial? Well, if you look at logic, it seems to be, no? It seems to be, because we are having protection despite the mixing and matching, but this has still to be proven scientifically. Now, about the fourth shot, lalo pa, wala pa tayong data dyan, no? Abroad, there is still no data about mix and matching because most of the studies there were done with homologous, yung pare-parehong vaccine. That is because abroad, or in the US and Europe and even Israel, they do not have our situation wherein we have many kinds of vaccines available. They really just have one series. So the only data we have is based on that premise.
Yeah, I think the issue really there was these countries that produce their own vaccines, they're able to do this. No, tayo kasi we were at the mercy of who was willing to sell to us. No, parang kung anong meron, sige na, pabakuna na tayo kasi any form of protection is better than none. So now as we look back and we think about mix and matching, I think we have a little bit more. What should I say? We're wiser now. I think we have more access to vaccines. But it will be very interesting to find out what the results of mixing and matching will be. I remember in the early days, Canada was doing mixing and matching because in their eyes, parang basta't mabakunahan kayo, parang ganon, no? So ngayon, meron na tayong luxury to think about, dapat ba pare-pareho, dapat ba, yung ganon. So I think, the research is very, very important as Dr. Recto says. Raymond, go ahead.
This one, more of a policy question, so I'll pose it to Dr. Recto.
For you, Raymond, for you, if it's a policy question, ikaw nakaupo sa
it's coming in from one of our regulars, Dr. Susie, Dr. Joseph Tortona. He says that he's a frontliner, senior citizen with comorbids, had this booster, so I suppose his third dose, November 26, after full vaccination. So the question, why is it taking the Department of Health so long to announce kung pwede na daw po ba siyang magpa-second booster?
Sige, go ahead.
Is the doctor a senior citizen?
Yes, ma'am. Opo.
Yes,
Opo.
Oh, he can already receive it. He can receive it as long as you are fulfilling the qualifications of being senior citizen and you have comorbid. Actually, just by being elderly, you can already receive it. So, right now, the vaccination centers are open. They have whatever available vaccine. You can actually go and have it. They will allow it, the fourth shot for you.
Okay, so pwede na, Doc Joseph.
Okay.
Totoo. Tama
Yes
ba?
po. Yes po.
Yeah. Go ahead, Raymond.
The next question po, and this is very, very common, and we're seeing this in, not just in Zoom, but in our other platforms po, no? There are those who have received po J&J, which was just a one dose po for the primary series. And to your point, Dr. Recto, not to really call the third dose as a booster already. So does that mean na yung J&J po ba ay mahina daw po as it is na one dose lang siya na ibinibigay even if nakapagkuha na daw sila ng mRNA as an additional dose?
That's the misconception. Just because the J&J was one shot, it's a weaker type of vaccine. It's just like the Sinovac, no, na parang weaker raw siya kasi whole virus. But, the concept of boosting will actually take that away, that weakness. Because right now, the studies are showing, and I think some practices in Europe, that they give the third shot as a heterologous, no? So, parang basta may mRNA component, it can boost the response. Now, itong si J&J, it was really studied that at one shot, they achieved the target level of antibodies that are similar to the other vaccines. It doesn't mean that it's weaker. So if you received the J&J and you had a, let's say, a Moderna shot, then that you practically received the primary series, which was the one J&J and the third shot. So parang ano na yon, katumbas siya ng dalawang Sinovac and a third shot or dalawang Pfizer and a third shot. Ganun yon. So hindi siya weaker immunity. Now, about the next shot, yung third shot ng J&J with Moderna and another, whether it be another kind of vaccine, hindi pa na naman natin alam yan.
Yeah, that's very interesting. I think Raymond and MARYSIA and Jen, no? Kasi parang we think about the comment na mahina ba yung vaccine, right? It's almost as if the vaccine is a drug. No, I mean, the vaccine is stimulating your immune system to respond. So it's a very different concept, no? Parang iba yung ibig sabihin. So anyway, I think you answered the question, MARYSIA, no, na parang whatever it is that you've taken, there is stimulation of your immune response. No? So I think the question will be, and I think the question in the future will be, which I'm going to ask both of you, right? Do you think this is going to be like influenza, where we have yearly shots? What do you think?
Jen, go ahead.
Dr. Jen,
Yeah,
opo,
Jen.
I have a
Jen,
follow-up
yeah,
question to that. Opo.
Jen, ikaw. Oh.
Jury's still out. It's hard to really say how it goes, no? But from what we're seeing, it may, no? It's a coronavirus that, and the behavior of it now is that there may be need to have some yearly boosters, no? So we can't say for now how it will go.
Yeah, okay. Raymond.
Dr. Jen, just for the sake of our audience po, no, and just because we're seeing a lot of these questions, and we've discussed and we've touched on the seasonal flu, so that they can hear it from you, may mga tatanong po ba, is it a reasonable, shall we say, rational to just have the seasonal flu instead of the COVID vaccine, Dr. Jen?
So the answer there is to get them both, no? So just because you have the COVID vaccine, you should still get the flu vaccine. The recommendation still stands. So it's not one over the other, both. You get the flu vaccine, you get your coronavirus vaccine, and if also indicated, you get your pneumonia shots also.
Can I add to that?
Sige, go,
Yes,
MARYSIA.
ma'am. Go ahead.
The flu is a different infection. The flu virus is different from the COVID virus. So it will not, one will not take over the other effect. You have to have stimulation specific to the virus, no? And it has been found that the antibody levels of either can vary, no, the waning. So nakita nila itong sa flu, annual pwede. Pero sa COVID, hindi pa talaga sure. The longest time na nakita nila is 6 months, no? In fact, they found that COVID immunity or COVID antibody can last for 6 months. That is based on a study that lasted for 6 months. Beyond that, hindi pa natin alam. So again, meron pang gray area for the COVID vaccine.
Thank you. Raymond, go ahead.
Okay. Next question naman po is, why are booster shots not yet offered for the pediatric population? Less than 18 po.
What I know is that the FDA has already reviewed this for the younger population. Now, why it's not being rolled out yet, I'm not so sure, Raymond. Baka you're the one who can answer that. I have no idea.
Okay. So, well, in terms of policy po kasi, they really are operationalizing it, they're waiting for recommendations from the experts, well, which includes the HTAC. That's as far as I can mention for this webinar. With regards to the booster shots.
Secret ka pa, Raymond. Dami secret pa dyan, ha?
Kasi it's as Dr. Recto mentioned, that it's evolving. The reviews are continuing din naman po, Dr. Susie. Okay.
Yeah, okay. So I knew this question was gonna come up, and it's from one of my friends on text. Dalawang had 2 shots and had a COVID infection. Kailangan pa ba ng 3rd shot?
2 shots and a COVID infection. So that's a hybrid immunity.
Yeah.
Okay. Now, that's again another $1 million question. So 2 million na tayo. Kasi
2 million na, oo. Oh,
Uh,
sige.
there's they call it the correlative protection. Correlative protection means maybe the best way so far for vaccines is looking at levels of antibodies. How low is dangerous that you also need to give another shot. Hindi pa talaga yun napepeg. Yung in Israel, they did it in a study, 700 BAU. In our country, I've been asking infectious disease experts about the correlate of protection and wala pa talaga dito. Ngayon, they have mentioned, some of the infectious disease experts, I wish we had one in the panel, but they have mentioned to me that there is a cutoff that they use using a certain neutralizing antibody test called the CPAS. Now, is this standard? Is this recommended? I'm not really sure. But they said that based on some studies, there is this correlate or level of antibody that will say, okay ka pa. So if you had two vaccines and natural immunity, are you still high in your CPAS? Is antibody level still acceptable? Ayan, wala na naman tayong sagot pa.
We don't know. So the other one, MARYSIA, again, on my phone, right? This person had 2 Sinovac shots. And, this was not allowed, but it was done. And 2 Moderna shots. Kailangan pa bang mag-booster? Senior na to.
So, theoretically, if you look at this person, he actually received 4 boosters.
2 boosters.
I mean, sorry, 2 boosters. He received
2 boosters.
So he got his primary series, he got his 3rd shot, and he got a 4th shot. Now, the problem is, ito bang interval between the 3rd and the 4th shot was enough to generate enough neutralizing antibody levels? Because I'm aware a lot of people did this, that they had it in the private, sector. They had an option to use it. So the question is, they actually did it like a primary series, mag 1 month apart lang. Yung 3rd and 4th dose.
Parang binaliwala nila yung Sinovac. Parang gano'n.
Actually, when you put that, hindi siya dapat binaliwala. Kasi yan, meron pang effect yung 1 and 2 doses ng Sinovac. Binoost mo ng Moderna. Tapos buboost mo ulit ng 4th shot. Now, ang tanong ba, itong level ng antibody, ayan na naman yan. Yung correlate of protection, na-reach ba niya? Paano natin masasagot yan? Wala pa tayong correlate of protection na level na talagang internationally or globally recognized. So
hindi mo na magpapaboost yun. Sobrang ng bakulan.
So, huminay-hinay na muna siya.
Ay, marami yan Raymond, marami.
That's true.
Marami yan. Ganun ang ginawa nila. Oo, na parang yung company nila nung nagkaroon ng Moderna, nagpaulit sila. So, anyway, sige, Raymond, may question ka pa dyan. I have another.
We keep on hearing that immunity wanes at the 6-month mark. I mean, in general po, no? But in terms of the policies that are in place, the 3-month interval po is being allowed na po, di ba? Pag 3 months na daw, pwede daw kung kumuha. So, based on science, is that too early po ba? I mean, in terms of receiving, or would you recommend talaga na even if the policies say that as early as 3 months, pwede na, should they still wait for the 6 months?
So, based on the immune system, the movement of the immune system, remember that we have T-cell memory. The T-cell memory and B-cell memory, they don't happen right away. You have to wait. You have to wait for it to set in. That's why they said that if you do boosting too early, then you are not going, you might not able to be reaping the rewards of that immunity, of the T-cell memory immunity. Kaya yung initial studies with AstraZeneca was that, di ba dati sinabi nila after 2 weeks, 1 month, bigay na. Pero mamaya sinabi na mas maganda raw after 6 months. So this was determined as it evolved, as we started using it, we saw that ay mas maganda pala pag malayo. And it makes sense because if you remember my graph, the antibody response is generated initially, but then it will wane, and then the T-cell immunity, which will come later, is the one that is actually very important, especially for severe disease. So if you keep on boosting, baka hindi nyo ma-achieve yung memory na yon para lagi siyang nagpo-produce ng antibodies. Now, as Jen mentioned, hindi naman napapagod ang immune system. Ang problema lang, baka hindi enough time to generate long-lasting immunity.
Yeah, so it's the ability of the body to remember, no? Parang yun ang binuboost natin, yung memory. I think that's what you're saying, Marisha, right?
Yes. We actually have two boosting, the antibody levels and then the T cell and B cell which hold the memory. So, pag naubos na si antibody, itong si T cell and B cell na naka-standby lang sila, na meron silang memory, pag they get in touch or the person gets in touch or in contact with the virus, ma-activate na naman, magpo-produce na naman ng antibodies. But it takes time for T cell memory to develop.
Yun, alam mo Raymond, di ba nung nag-aaral tayo ng medicine, sabi ko na nga ba mali yung yung paulit-ulit mong minimemorya? Hindi mo, hindi mo maalala. You have to give some time for it to sink in. No, I'm serious, di ba? Yung
Space
yung
learning.
parang aral ng aral, habang kumakain, inuulit, it does not sink in, no? So, I don't know, I just thought that was funny because I thought, oh, that's like studying pala, no? Parang, you should not saturate, di ba? Parang, wag yung pilitin, parang, I think what Marisha is trying to explain is that in this whole process, you are helping your body remember. Okay, so kung laging pinaaalala, baka lalong makalimutan. May question ako rito, Marisha and Jen. Okay. Pregnant and lactating. It's in our chat, in our Q&A, no? How about pregnant and lactating women? What is a good time to get that third shot?
So when we talk of pregnant and lactating women, they're usually at the last because most of the studies would be done first in the regular or normal population. But if we can extrapolate based on what we've seen on the effect of the COVID vaccine for the first and the second or dose or the primary series, their reaction is actually similar to that of the regular population. And the important thing here is that there is almost no risk of teratogenicity, so they can be treated as the general population also. So the same recommendation should apply.
Okay, great. So that means it's safe, no? Okay lang na, no? Parang you're not pregnant. Okay, so when it's time for your third shot, just have it done. Like you're not pregnant. Raymond, ano pang meron dyan?
Question, phone-in question po. Coming in from Viber.
Ay, ako nga, Viber yung nakuha ko
I'll pose this to Dr. Jen. Is there immune exhaustion with repeated vaccine doses po?
Okay. So that's a very good question. No? So immune exhaustion means that the antigen, or for example, the when you're giving the vaccine, the antigen is persistently present. No, so that's what we are doing with the boosters. In other conditions such as HIV and cancer, the T cells really go down. The immune exhaustion has been shown, but for the COVID vaccine, there are no studies supporting this immune exhaustion at the moment. So right now, the answer there is no. No, there is no evidence that there's there's T cell exhaustion when you continuously give your booster doses.
Dr. Jen, yung po bang immune exhaustion is that, obviously we don't know as much or there's limited evidence for COVID, pero dun sa mga alam na natin ng mga bakuna, yung mga flu, etc., is there parang mayroon po bang klase ng bakuna na prone sa ganyan, sa immune exhaustion, ma'am?
Maybe we'll clarify first what immune exhaustion means, no? Because essentially, the immune exhaustion is when the antibody levels go down, no, after the event, no? So in other diseases, we have seen that when the T cells no longer respond as much because there's persistently high levels of the antigen. So what I'm talking about would be, for example, HIV. So there's always the virus present, and over time, the T cell response is not as good. But for the vaccines, we don't see that yet.
Okay, thank you so much. Dr. Susie, questions?
Yan, naka-mute ako. Teka, ito, meron ako isa pang questions. Sandali. Ay, nawala, Raymond. Sandali. I was just reading it earlier. Anyway, it had to do with timing of the booster. Na parang if you have the 2 shots already, how much time can you actually wait or delay getting that 3rd shot, Marisha?
Okay, that's a very good and relevant question, no? Because some of us, including myself, I have to put myself in the undecided. Okay, we are waiting, and we don't know if what we've received will go away. We have to remember, no, it will not. Okay, because we have our immune memory. Remember the T cell and B cell memory that I have discussed. It is there. It just needs to be boosted again. So, and when we talk about boosting, it is the antibody boosting that will be elicited, no? But the T and B cell memory is there. It's there in our bone marrow. So, wag tayo matakot. In fact, nga, even with ordinary vaccinations, di ba yung ating mga Hepa B, mga DPT vaccines in children, if they are delayed, you do not repeat you don't start, you continue, even though there's a gap between. So that is basically the principle. We have not wasted it, even though we wait a bit. But we have to also be in tune as to when is the best time talaga to take it again. And so we're still waiting for that data on long-term studies, no? Like after 6 months ba, meron na bang evidence na nag-last ng longer than that? Wala pa tayo. So far, 6 months pa lang yung nakita ko na longest time for vaccination antibody levels to stay okay.
Okay, so what we're gonna do is when the evidence comes out, we're gonna have Marisha on the webinar again, and Jen. Ang galing nila no? Parang parang ang daming malinaw. Pagka malinaw na, kasi that's the question di ba? Parang how long can I wait? No, some people want it right away. Some people are like, can I still wait a little bit? Okay. So thank you very much to our 2 speakers. We have a a 3rd year resolution that we will try not to go over 2:00, and so we're going to give our tinan mo, puro heart, so tuwan-tuwa sila sa guest natin. So we are going to give our speakers a few minutes to sort of compose your parting message for our audience, who I'm sure benefited very much. If you can see all the hearts and all the clapping coming out, no, parang talagang very much appreciated yung mga yung presentation. Oo. So sige, while we're doing that, Raymond's going to do our answer to the fun quiz.
Opo. I'll just read it kasi hindi naman po talaga siya can we have the Slido also on the screen? Thank you so much. For the first question po, we just wanted to know sa ating sa audience. So kung kayo po ba ay magpapa-second booster, kung ito po ba in-offer sa inyo sa ngayon. In the Zoom, 80% of attendee or participants said that they will take it. 5% said no, and may 14% po na undecided. Dito naman po sa Slido po natin, 70% ang nag-yes, sumunod po 19% na undecided at 11% po ang nagsabi ng hindi. So medyo malaki rin po ang porsyento ng ating attendees na both undecided at saka dun po sa hindi na po sila magpapa-second booster. For our second question, it reads, ang COVID-19 booster ay nakakapagpaigin ng immune system. Dito po sa Zoom, 94% of those who answered said it's true. Dito naman po sa Slido, 89%. So very, very important po as a takeaway message. And this has also been reiterated naman po by our expert speakers for today. We will also do our evaluation poll right now. Can we have it on the screen while our experts are taking their time to craft their parting messages po, no? It's a 5-question survey, a 4-point Likert scale. It reads, the panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. Panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing virus health issues. We will not be closing this evaluation poll. And again, wala po kaming hiwalay na sinesend out po na evaluation poll. Ito na po yun, bali. So we hope you'll be able to key in your assessments and your answers to the evaluation before you log out sa ating webinar. Maraming salamat po. Thank you. And back to you, Dr. Susie.
Thank you very much, Raymond, and thank you so much to our audience for participating in the fun quiz and also in the evaluation. Okay, so let's start with parting words from Dr. Jen Agustin. Jen, please go ahead.
Okay, so most of the adverse events following immunization are non-serious. They are mild reactions. And with this knowledge, this can help vaccine hesitancy, so to eliminate vaccine hesitancy. So as healthcare providers, we should take the time to promote confidence in the COVID vaccines and encourage our patients to get the primary series and the booster shots when available.
Thank you very much. That's Dr. Jen OTADOY-AGUSTIN, Division Chief of the Division of Allergy and Immunology of the Department of Medicine, Philippine General Hospital. Okay, let's go to MARYSIA, RECTO. Go ahead.
Yes, so the question about whether to receive the fourth shot or the fourth or the second booster is still actually not very strong. The evidence is not yet very strong because we still need a lot of studies. We only have seen it in a certain country using a homologous vaccination. But we have seen that theoretically the role of boosters is really there, for vaccination. It's important. Now, the details as to how long, how often, what booster, that still has to be determined. But what we know is that the elderly and those who are immunocompromised or on immunosuppressants are the most vulnerable. And whatever it is, they seem to need the booster more based on the study. So in other words, we still have a lot to learn. We still have a lot to know before the rest of the population can be given the boosters. And most of all, we have to think of that public health concern about vaccine equity as well, wherein even though we all get 10 boosters, if a lot of people don't have yet the vaccine, then we will really not be able to control this pandemic.
Thank you very much. That's Dr. MARYSIA RECTO, who's the immediate past president of the Philippine Society of Allergy, Asthma, and Immunology, and also professor at the Division of Allergy and Immunology, Department of Pediatrics, Philippine General Hospital. Thank you very, very much for your time and your contribution to this discussion. And to summarize to do our synthesis, magagaling man nagsisynthesis sa atin, parang talaga, parang meron silang mga special power. We have Dr. Stella Marie Legaspi Jose, who is the Deputy Director for Health Operations of the Philippine General Hospital. Stella, over to you.
Good afternoon, everyone. It's my privilege to give the synthesis and closing remarks, and I would like to thank Dr. MARYSIA RECTO and Dr. Jen Agustin for a very enlightening webinar. There are so many questions that are answered and unanswered, but let me just recap what MARYSIA has mentioned. So she said about immunization, we have active immunization, that is the vaccine. We have the convalescent plasma therapy and the designer antibodies. So these are the engineered antibodies. And I took note of the vaccine efficacy. And she said that overall, the efficacy rate for Moderna is 94%, Pfizer 95%, and Gamaleya 92%. So all these vaccines are very effective. The efficacy rate versus severe disease, almost all of them they are efficacious against severe disease. So that's one thing you should remember. Now there is the concern about the waning immunity, and I took note of her PowerPoint for children and for adults, and she said that 1 to 30 days after the second immunization, there's already the waning of the antibody levels, and so. She reviewed with us the Vaccine 101 series, what we lecture to our medical students. And the response to the primary shot, of course, it rises and then it decreases. And the antibodies in the serum decrease. There's the primary response. Then the antibodies that are generated decrease, they wane, and that's why we need the booster shot. But let us take note of this very important statement. She said that the CD8 T cells, the vaccine-generated immunity by the CD8 T cells are better than infection. Okay, so vaccine generation is really the vaccine-generated immunity is really the key to be COVID-free. No, so we have to be immunized. She said that daily vaccine effectiveness, there's increased protection against infection, severe infection, symptomatic COVID, and death due to COVID. But her parting message is comparing when we think of the fourth booster versus the third booster, she mentioned that the fourth booster provided additional protection against SARS-CoV-2 infection and severe disease. No? So it's important that we have this. But as mentioned also earlier by MARYSIA, we have to wait for the T cells, the memory cells, to be active. No? So the duration, the time when to give the booster is still ideal time is still not yet definite. No? So, and for Dr. Jen OTADOY-AGUSTIN, she mentioned about the adverse events after vaccination, and some of the what we can call serious adverse events are neurologic. No, that is the Guillain-Barré syndrome. But in her lecture, she mentioned that product-related accounted for only four patients, indeterminate are 5, and undergoing review, there's a lot of patients undergoing review. Then the Bell's palsy product-related is also only 7, indeterminate 2, coincidental 2. So, if for the neurologic adverse events, it is not a what we can say a common event that the patient will have a neurologic adverse event. Myocarditis happens because of molecular mimicry, so the spike proteins and the self antigen. So it can be a pre-existing dysregulated immune pathway, that's why the patient will get myocarditis, or it can be an immune response to the mRNA, or the activation of the immunologic pathway. It can also be a dysregulated cytokine expression. Okay, so why is it more common in males rather than females? Because she said that there can be underdiagnosis of heart disease in females. Now, the conclusion of Dr. Agustin is that the benefits of the COVID-19 vaccination far outweighs the risk or outweighs the known and potential risk of the vaccine. Now, most adverse events are reactogenic and they resolve quickly. So we should not worry too much about them and focus on having our family vaccinated. So I think that is the main message here. And she said that adverse events are really, really important to take down. So we have to, for all the healthcare professionals here, we will take note of all these reminders. Back to you, Susie.
Thank you very much. That's Dr. Stella Marie Legaspi Jose. I don't know how she and Menchi do it, how they're able to summarize, but thank you for the excellent summary. And we are grateful for your being here and for your strong support, no, for getting all our powerhouse speakers on the webinar. Stella, maraming salamat. Okay, next week, very interesting. You know, the World Health Organization has just released a report that there is a mysterious form of severe hepatitis of unknown origin in children. And it is now in 11 countries. It's mysterious because, or not of unknown origin, because usually hepatitis or yung pamamaga ng atay, galing yun sa hepatitis A, B, C, D, E. Diba? So you get these kids who are very jaundiced. They have diarrhea, vomiting, no, but they're not presenting with any fever, and there's no hepatitis A, B, C, D, E. They can't find that virus. So what's happening? Why are these children looking like they have hepatitis A, B, C, D, E, but they don't have hepatitis? So they're studying it now. The 11 countries include the United Kingdom, where they saw the biggest number of cases, Ireland, USA, Denmark, Netherlands, Italy, Norway, France, Romania, Belgium. So mainly in Europe. And they have seen in some cases adenovirus. Now, this is another kind of a virus, but usually the adenovirus does not cause hepatitis. So what's the interesting twist? The interesting twist here is that some of these children have tested positive for COVID and adenovirus at the same time. So parang may dalawang virus na nagsasama ang lumalabas, nagkaka-hepatitis yung mga bata, and they have elevated liver enzymes and all of the features of hepatitis, but they do not have the hepatitis virus. So we are going to talk about that next week. So invite your friends. No, this is going to be a kind of like what should I say, like ahead of the curve kind of discussion. It's not here in Asia. It's mainly in the temperate zones of the West. But you know, when COVID started, it was 200 cases in China. This is 169 cases that have been reported, and they still don't understand what is happening or why this adenovirus is causing hepatitis in children. So we're going to talk about that next week. Okay, Raymond, over to you.
Thank you, Dr. Susie, and thank you so much for everyone who were able to attend our episode number 99. We are seeing on the screen the results po of our evaluation poll. At least 93% po. For all questions, they indicated that they strongly agree with the statements as mentioned, this 5-question survey that we have. So maraming salamat po sa inyong lahat. We'd also like to thank the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, from the University of Philippine System, from the National Telehealth Center at the UP Manila National Institute of Health, the Information Technology Development Center of UP, TVUP, of course, the Internet Television Network of the University of Philippines, the UP Philippine General Hospital, the UP College of Medicine, and everyone who has helped make this learning series possible. Maraming salamat po for helping us churn out quality content week in and week out. Finally, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. If you go to www.youtube.com/TVUPPH, all of the 98 webinars and then 99 after today's webinar, and also our SCD shorts can be found in the TVUP channel po sa YouTube. This formally closes po our webinar for this week. We hope you'll be able to join us again about this, I don't want to call it mysterious, but it's of unknown origin. Ito pong hepatitis po natin for next week. So hopefully we'll be able to learn again so much about this this disease of unknown origin. We hope that we're better prepared for this one. Again, we look forward to your company next week sa ating susunod na Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
Keep safe, keep healthy. See you online!